Hello, 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 and welcome to Wellness Wednesday with Dr. Latoya Wells. I am Dr. Latoya Wells, Doctor of Nursing Practice, family nurse practitioner, and owner of Wells Legacy Health and Wellness, here tonight for another episode discussing some important health topics. Before we jump into our topic for tonight, I just want to give an update on some things that are happening here with our practice. We are in the community doing different things, connecting with different partners to bring healthcare to the individuals in our community. And I'm so excited about that. We're also credentialed now with several major insurance companies. So if you are looking to sign on with a new provider, looking to switch, if you don't have a primary care provider and you need to get established, we are here for you. Reach out to us at 321-306-6755. You can also book an appointment on our website at Wells Legacy Health and Wellness. But give us a call. Let's see if we are part of your plan and see if we can get you set up for your first appointment. I'm excited for tonight. We're discussing another health topic that's so important, and it's brain health. June is Brain Health Awareness Month, and we're going to be talking about all things brain health. Tonight, we're just going to go over some frequently talked about conditions dealing with the brain and some statistics. You guys know I love my stats, and just some different things that we're going to discuss related to that. So did you all know that there's one organ in your brain? I gave it away. There's one organ that we have in our body, which is our brain, that essentially is the control center of the entire body. The brain has different parts of it that tells when to do this and this part of the body to do this. And if our brain is not functioning properly, it can impact the entire body or a portion of the body. And as I mentioned, when we're looking at the individuals, we look at individuals holistically as the whole person, not just part. And you all know I say this often. If there's one part of the body that's not functioning well, it impacts the rest of the body. And so the brain controls everything: movement, your thoughts, memory, and essential bodily functions. Brain health is impacted by many things. Genetics, such as when we look at individuals who have some types of dementia and Alzheimer's, we see that there's a family history. Lifestyle, if individuals live high risk lifestyles, they're at risk for brain injuries. Individuals who have any type of injury, infection such as encephalitis and some other infections that can impact the brain. And then chronic diseases can also impact the brain. If individuals are at risk for stroke and there's decreased blood flow leading to the brain, it could definitely cause those individuals to have some issues with their brain and other medical conditions as well. Brain health is not just about avoiding diseases, it's about optimizing and making sure that we're maximizing the functioning of our brain and our quality of life. As a healthcare provider, when I'm doing my physical exams and I'm interviewing my patients, which is what we call review of system, I'm asking certain questions. And while I'm asking those questions, I am assessing and establishing their cognitive abilities and their cognitive functioning. Where are they with their brain? How are things working? Are they able to recall what happened to them 10 years ago with their medical history? Are they able to remember these 3 words that I gave them 10 minutes ago? And then after I asked them a bunch of questions and asked them to draw the clock, can they recall those things? I'm looking at their short-term and long-term memory. Has there been a decline in things over time? And so these are things that we look for. And it's so important that individuals are connected with a healthcare provider who can follow up with them and who knows their baseline and can tell when there has been a change in their overall health. So when you think of the brain and brain health, what's the number one thing that comes to mind? For me, is stroke. And a stroke is a health condition that can be detrimental to someone's life. And there are things that we can do to prevent strokes. And then there's some things that, it's just, there's nothing that we can do to prevent it. It's going to happen regardless of whatever, depending on what's going on with that patient. But for the most part, it's a preventative thing. And so a stroke is when the blood supply to part of the brain is impaired or interrupted. And typically it's from a blood clot or a piece of plaque that has broken off and gone to the brain. It could be from a trauma. It could be from surgery. Different things can cause it. The most common type of stroke is an ischemic stroke, and that's where there's a blood clot or a piece of plaque that obstructs that blood vessel, and there's not blood flow going to the brain or part of the brain. The other type of major stroke is a hemorrhagic stroke, and that's where there's a blood vessel that bursts, and we most commonly as a brain bleed is what most people hear it termed. And that's where there's a blood vessel within the brain. It has ruptured and blood is not flowing properly through the brain. When we look at statistics and percentages, it's important to know, and for me, this number is astounding, that every 40 seconds, someone in the United States has a stroke. When you think about the number of seconds within a minute, in an hour, and in a day, that number is pretty high. Stroke is the 5th leading cause of death in the United States. And when we look at communities and ethnicities, those that are Hispanic and Black, those individuals in those populations have a higher risk of developing and dying from strokes. When we look at strokes, and over time, we've been taught to look for certain things, the drooping, the weakness, speech, things of that nature. There's a acronym or a synonym acronym that we are now teaching, and that's FAST. F-A-S-T. Is their facial drooping? When we're looking at their arms, is there weakness? Is the strength equal on both sides? Speech. Are they having difficulty speaking? Is their speech slurred? Are they having difficulty understanding? Are they able to speak at all? Is their speech making sense when they're talking? And then time. If you notice any of these things, it's time to act and call 911 immediately. The quicker we get help to this individual, the better their chances are going to be. And so when to seek help when we find or we think that someone is having a stroke, immediately. Get help quickly for that individual. It can definitely save their life. The next thing I want to talk about is traumatic brain injury. And this is timely considering we are at summer and we see an incidence of increase in risky behavior and activities during the summer. Kids are out of school, families are going on vacation, and so individuals are freer. They're at liberty to do different things. And so traumatic brain injury is it's a disruption of brain function caused by a bump, a blow, or a jolt to the head. And it's not just caused by someone hitting someone in the head or falling and hurting themselves. Someone can sustain a traumatic brain injury in a car accident because of a hard hit from behind or the side or front, where their head kind of does a rapid motion back and forth, and the brain is moving back and forth, hitting the skull, which can then cause some swelling of the brain, and which is what we call a traumatic brain injury. But for the most part, we see it in individuals that are having falls. These individuals have been hit in the head, diving accidents, things of that nature, who are at risk. So when we think about individuals at risk for traumatic brain injuries or TBIs, it's children between the ages of 0 and 4, teenagers between the ages of 15 and 19, and then those who are older than 65. Athletes, of course, because of concussions, falls, hits, things of that nature, injuries that may occur when they're playing, veterans, and then people who have been in accidents. Those individuals are at higher risk for developing traumatic brain injuries. Some of the symptoms can include confusion, headaches, problems remembering things short-term and long-term, nausea, may have some vomiting, and then slurred speech. There's 2 different types of traumatic brain injuries. We have mild and then we have more severe. With the mild TBI would be considered a concussion. I think I've spoken fairly openly about this. Our youngest daughter was a volleyball player for Howard University, and go Bison. Side note, my husband and I said that we both went to a HBCU because our daughter did. But she played volleyball for many years, not just at college, but from the time she was in elementary school. But it wasn't until she was in college that she sustained a concussion, and she had two concussions. And because she and I both suffer from a specific type of migraine, it puts us at a higher risk for prolongation of the symptoms if we were to get a concussion. And she was a classic case. She got hit in the head with the volleyball during practice or during a game. I can't remember the exact circumstances, but she sustained a concussion, and it took her longer to recover from that because we have migraines with auras. And so not going to get into much of that tonight, but just know that some individuals are at higher risk for more complications or prolonged symptoms than other individuals based on their health history and also their history of concussions. And so she, on her second concussion, we were really having conversations about her continuing on playing because her position that she played on the team and the risk of a subsequent concussion. And so we want to make sure that we're stressing anytime someone is hit in the head, they've fallen and hit their head. There was an actress several years ago who was out skiing. She fell, hit her head, and she was up in the mountain somewhere, went to sleep and did not wake up. And we hear these cases over and over, some individual sustaining a head injury or falling, hitting a head and not going to get medical attention. And the outcome is not good for those individuals. So we want to make sure that these individuals are being followed up after head injury, making sure that there's, especially if they're really sleepy or tired, if there's confusion noted, if there's vomiting, or if they're developing seizure or seizure-like activity, they need to be seen immediately. I say any head injury, anytime someone is hit in the head, just to be on the safe side, we want to get them checked out. And then another thing is encephalitis. We have many different conditions or things that can cause encephalitis. But when I think of one, during the summer, because the weather is hot, these bodies of water are hot, especially fresh bodies of water, is the amoebas that can cause the encephalitis. And there's different things that can occur that can cause encephalitis, but some of the signs and symptoms is, or encephalitis is an inflammation of the brain, and it's usually a viral infection, but it can be caused by some other things, organisms getting to the brain, things of that nature. But growing up in Florida, I just remember when I was younger having heard of a kid in our school who died from an amoeba, had an encephalitis from an amoeba. And so that just stuck in my head. And so I'm very cautious and leery about swimming in bodies of waters, that especially fresh body of water. But anyhow, it's just an inflammation of the brain. And signs and symptoms of that are headache, there's fevers, there could be some nausea, some vomiting, some confusion, are some of the top signs. Sensitivity to light, and then seizure. It's rare, but it does occur, about 5 in 10 per 100,000 each year, but can be deadly and can cause long-term disability. And so it's important that we get these individuals treated really fast. Another thing is meningitis. Meningitis can also cause encephalitis or inflammation of the brain. And so we see this most often in adolescents, teens, and adolescents, and which is why it's so important when we're talking about vaccinations that we're looking at different things to make sure that we can prevent certain diseases or processes from happening. And so knowing the signs is important, and want to make sure that if there's a rapid change in their mental status and that there's a fever in a normally healthy young person or individual in general, we want to get them help. The next thing that I want to touch on, and then in subsequent Wednesdays, we'll do a deeper dive into the different conditions that I've talked about tonight. But I just want to give a high level overview of some of the different ones. One of the next one, and this is hit home personally, is Alzheimer's disease and dementia. Alzheimer's is the most common form of dementia. It's a progressive brain cell death. It's where the brain is slowly dying, and it progresses, depending on that person, it could be pretty rapidly. Dementia is an umbrella term. And I get this question, what's the difference between Alzheimer's and dementia? Well, dementia is one part of, or it's a type of Alzheimer's is a type of dementia. Dementia is the umbrella form that we use for a decline in mental ability, severe enough to interfere with that individual's daily life. And typically what we see is when I'm assessing some primarily older individuals, but I've seen dementia in younger people, and we're seeing younger and younger due to different substances and vaping and different drugs and, all the things that individuals are participating in now. We're seeing younger and younger cases of individuals with dementia and cognitive brain changes. When we're looking at statistics, over 6.7 million Americans are living with Alzheimer's. 1 in 3 seniors die with Alzheimer's or another type of dementia. Women and Black Americans are disproportionately at a higher rate are affected by Alzheimer's or some form of dementia. And when I'm looking at my older patients and when I'm assessing the cognitive functioning of a person, when I'm asking certain questions, depending on the answers to those questions, will lead me to do a further in-depth dive into their assessment. And so some of the signs is memory loss that disrupts their life daily. And I'm not talking about you go into the kitchen and you forget what you walked in there for. Now, if you go somewhere, I can't even really use that one, but because I've forgotten where I parked my car in the parking lot, simply because my mind is elsewhere when I parked and I just don't remember where I parked my car. I eventually find it, right? But if we have individuals who we see a lot of silver alerts in Florida, we have a lot of silver alerts, and I'll just lend to this point. When you're driving and you see these silver alerts pop up on the billboards, on the traffic signs, there's an elderly person that is missing. And most of the time, we see a progressive decline. They can't remember how to get back home. They drive somewhere and don't remember the roads that they're on and get turned around and get lost. There are so many elderly individuals that drive away from home and have not returned, and their family is still looking for them and they've gotten lost. So there's been some different things that have been put into place that can help with that. Some of the signs, as I mentioned, memory loss that interrupts their daily life, confusion to time or place, mood and personality changes. They can become aggressive. They can become very depressed, whereas they were very mild-mannered and calm. There's some drastic changes in their mood and in their personality. Difficulty completing familiar tasks, such as, individuals who usually exercise or they cook their own meals or they pay their own bills. We begin to see their electricity getting turned off because they are forgetting to pay their bills, or they don't know how to log into their bank accounts and things of that nature. And when we want them to get help is if there's memory issues or there's cognitive changes that's functioning, that is affecting their daily functioning. Whereas these individuals are usually pretty dependent, we're noticing these changes. And this is when it's important for families to rally around. Families to come around these individuals and provide the support and have those honest conversations. Many times we want to avoid it, or we want to downplay the symptoms or try and cover up. And these individuals can be very crafty at covering up what's going on because they don't want the family to notice, especially early on. Some questions you want to ask your healthcare provider when you're going to have your physical exam, or if you have a family member who is dealing with some of these issues, are what are my risk factors for a specific health issue? Knowing your family history is so important. If you know that you have a family history of Alzheimer's, dementia, it's important, or any other type of dementia or any neurological functioning issue related to your brain or other health, it's important that we notify your healthcare provider and let them know, so that way they are on the lookout that certain things can be tested genetically. They can do genetic testing if there's a specific thing that they're concerned about, especially if you're showing any signs and symptoms. Are my memory concerns normal or signs of something serious? I've had some women come in to me who are in their late 30s, 40s, and 50s. And for those of you who have dealt with and are dealing with perimenopause and menopausal symptoms, you know that there are times where we have issues with memory. And it's because of the hormonal shifts and changes, and some other things as well, the busyness of life, things of that nature, especially when I'm dealing with the younger mothers who have newborns and young kids and trying to remember all the things. And they're like, I think I'm losing my mind. I'm having some memory issues, and trauma as well can cause memory issues. Individuals who've dealt with a extreme amount of stress or grief or some type of traumatic issue can cause memory issues. And so we really have to, as clinicians, as providers, do a really in-depth conversation and screening with our patients to determine what's going on. Is this normal, or is there a serious issue that's occurring? Should I be screened for stroke risk? And again, when you're going to your healthcare provider and they're doing their initial assessment, they should be screening you for certain things, especially if you have a family history of stroke or high blood pressure. High blood pressure, again, is a silent killer. It does not show any symptoms for many people until it's too late. And it is one of the causes of stroke. And so we have to be on top of and be preventative and proactive when it comes to our health. It's so important that we, I'll go back to family history, that we know our family history, that we know what our mothers, fathers, grandmothers dealt with in their family history. So we have to have those conversations. And in many cultures, we don't talk about those things. And when I'm having conversation with my patients, not many people know what their family, their moms, their dads have dealt with, or what health history or what health problems they've had. It's so important that we know that information. When we're talking about stroke and stroke risk, high blood pressure, high cholesterol are two of the key things that could lead to individuals having strokes, as well as some other things. What lifestyle changes can I make for brain health? One of the main things is cutting down on smoking. Smoking can lead to a lot of different health conditions. Drinking alcohol, your diet, exercise, especially if you are someone with high cholesterol or high blood pressure. We want to do whatever we can to make sure that we are decreasing numbers to normal ranges, that we're exercising, and that we're taking care of these bodies that we have, because we only get one body. We only get one shot at doing right with these bodies. And if you know that you have a family history of stroke or hypertension or high blood, high cholesterol, then you know that you're at risk for these things. And lifestyle modifications can definitely help without having to put someone on medication. I'm not the first one to run to medication unless we necessarily have to. I want to be able to give my patients and my clients an opportunity to work through some of these issues and to take the medication if they need it. Well, not medication, make the necessary changes that are needed in their health, diet, exercise, lifestyle modification. And then if we get to a point where we have to, and medication is necessary, then we're looking at these medications that may help if that's necessary. There are many supplements that can be taken. But if you have high blood pressure and nothing that we're doing is helping, I'm going to encourage you to take something to bring down your blood pressure. Once we begin to get things under control, we can slowly try and wean someone off of a medication. Typically, if we have to start on a medication, then we are able to make those changes in their health. It can definitely be helpful. But again, it just depends on what that individual is dealing with in their health. It's important that you have a healthcare provider that you are comfortable with having hard conversations, and someone who is not going to try and pressure you or force you to do a certain thing. For me, we'll have these conversations. I'm going to give you the options. You decide what's best for you, and you go with that. If it is that you need to take a medication to get your blood pressure down, and I'm stuck on this medication for blood pressure because we see this most often. We have young individuals with high blood pressure who don't want to take medication and who don't want to put into effect all of the recommendations on their lifestyle modifications, and they're at risk for stroke. We have husbands and fathers, uncles and aunts and mothers and daughters, women and men who have high blood pressure and don't want to change any of their lifestyle things and put any new things into place and think that some fat diet or some supplement that they found on TikTok or something else can help. And it's okay for us to look at alternative treatment options. And I'm all for it. If it's going to work, if it has a potential to help someone, then we can definitely look at it and discuss it. Again, ultimately, it's your body and it's up to you how you treat it and what you put in it, right? And I'm not one to push someone towards one specific treatment option. We will look at some options. I've had patients come to me and bring in certain supplements and say, hey, I heard about this. Can you tell me, will this help? And as someone who has dealt with and is dealing with a health condition where I have to take a medication for, and there was a period of time where I didn't want to. My platelet levels have been elevated for a while, for a long time. And I did not want to go on to the medication. I tried to change my diet. I tried to do some natural supplements and things that I researched online. And it was a combination of the medication and some of the supplements that helped me with my platelet levels and keeping them kind of in a normal range. But it took some time for me to say, okay, yeah, let's go ahead and do this, because what I'm doing on my own is not working. And once we get to that point where we're able to understand, yes, I do need to take this medication, because if not, I'm at risk for having a stroke. I'm at risk for certain things. And I had to weigh the risk versus the benefits of that treatment option. So my provider was very open and willing to talk with me. Before she even sent me to see the hematologist, we were going back and forth, having discussions every time that I saw her. But once my numbers got to a certain point that she wasn't comfortable caring for me at that point, she recommended I go and see a specialist. And I did that, found an amazing specialist, and he listened. They listened to me, and we developed a plan that worked for me. And that's what it's all about. Lifestyle modifications for brain health. Do the things that are going to increase your health when it comes to your brain. What I tell people is do brain activities, Sudoku, crossword puzzles, word search, things of that nature, things that are going to challenge your brain when you go into the store, especially my elderly individuals. If you shop at Publix and you usually come in and you go right by the flower shop and then you go down by the deli, next time you go in, go left instead of going right. So go the opposite direction as opposed to the same direction that you would always go, right? Do the things that, if you're predominantly right-handed, do things with your left hand. Brushing your teeth with your left hand. Do things that are going to challenge your brain. And there's so many different brain activities and brain games that are available now that help. If you start to have some issues, be honest. Don't be afraid to mention it to someone. I can recall years ago, there was a lady that was a part of the family, and her significant other, well, there was a family member who had a significant other who was diagnosed with dementia, and they were so afraid that they did not want to live life with dementia that they took drastic measures. And it didn't have to end that way, right? There's been so many developments in dementia health and Alzheimer's treatments now that individuals are living longer. We're able to prescribe treatments that are not eliminating the symptoms, but can definitely prolong the progression of certain things. And when should you see a neurologist? A neurologist is a specialist who deals with the brain and the neurological system. And anytime you are having any symptoms that are outside of the norm, that fall outside of the scope of primary care, then you should be seeing a specialist. For me, as a primary care, I know my limitations. I know that there are certain things that are outside of my wheelhouse. And once I have a patient who is at risk for certain things like stroke or Alzheimer's dementia, after I've screened them and I see where they are in terms of their risk, we're referring them out to see a neurologist. It's all about making sure that you are getting the best care and that you have a healthcare team that's on your side. There's so many different resources that are available. I know of many individuals who are dealing with family members who have dementia at the moment, and there's resources out there. Reach out. You have the National Alzheimer's Association, you have the Brain Injury Association, you have a bunch of resources available. And so reach out. If you need assistance or you need help getting connected to a support group. We also provide um, patient assistance in helping you guys to get connected with different resources. So reach out. There's the Stroke Society, there's the CDC that has a lot of information available online. There's some local resources within Florida. You have the UF Health Memory Disorder Clinic. You have Advent Health, and Orlando Health also has some amazing resources available. There are many different resources here locally. And you have Wells Legacy. We're here for primary care screenings and also for memory assessment and referrals if needed. Stay safe, be well. Make sure you're taking care of your brain. Your brain is your most powerful organ. And it's so important that we protect it. Early detection, healthy living, regular checkups are key. If you or your loved one are experiencing any symptoms that we talked about tonight, don't delay getting them help. Seek help, get support. I want to say thank you so much for joining me tonight. Stay aware, stay well, and keep your mind in motion. Stay safe and be well. This is Dr. Latoya Wells with Wells Legacy Health and Wellness. Until next time, take care of your brain and take care of you. Take care. Bye.